Okay, so let us continue with Alan's keynotes study streak, and we are discussing of remedies, a few remedies from the Alan's keynotes, especially those that are hemorrhagic diathesis in nature, or that those that bleed profusely from one part or different parts of the body. And in continuation with different remedies that we are doing from Alan's keynote, this remedy which we are discussing today is a connection of the previous few sessions. Like in the last few sessions, we have discussed hemophilis, crotalus horridus, naja, and today we will discuss a remedy which is creosote. And this is also one of the very interesting remedies. If you see this source of the remedy, it is distillation of wood tar. Now a remedy which is a distillation of some product should definitely be understood that it will have lot of features of that product, and the product is wood tar, and this is the distillation of wood tar. So there will be lot of decay, lot of bleeding, lot of hemorrhage, and other things that we'll see in the provings and the different people. So let's begin with the remedy. In Allen, what we have is for creosote: dark complexion, slight lean, ill developed, poorly nourished, overgrown, and very tall for her age. We have often given phosphorus for these patients, for children who grow very fast. We should give a thought to creosote if there is a involvement of teeth and decay of teeth, which should point to creosote more often than phosphorus or calcarea phos or other remedies. Children who are old looking, so those who grow very fast and also they look very old, they look very senior as compared to their age. There will be a child who is around 8 years of age, but he will look like he is 12 or 13 or 14 in his teens. That should point to think about creosote. Like the remedy abrotanum, there will be skin which will look wrinkled or hangs in folds because there is not properly nourishment of the body. Scrofulous or psoric affections, rapid emaciation, a thin lean fellow with decay of the teeth or hemorrhagic diathesis should make you think of creosote. Iodine is one of the other remedies that should come in mind in such scenario. Next you have is hemorrhagic diathesis. Small wounds bleed profusely or freely. We saw this in crotalus horridus. Snake remedies, lachesis, naja also have it. Phosphorus is one of the other remedies. Naja will not have so much of hemorrhagic diathesis, but circulatory disturbance, especially the region of the heart, will be affected. In creosote, there is hemorrhagic diathesis. The blood will be very much flowing freely, and the flow will be passive in epistaxis, hemoptysis, hematuria in typhoid, followed by great prostration, dark oozing after extraction of tooth. There will be patients who will tell you that after the extraction of tooth, this bleeding has not stopped, and when you check the blood from the bleeding or from the teeth, from the broken teeth or the operated teeth, it is going to be dark uh, blood, black blood, brownish in nature. Think of creosote, think of hemophilis in such situations. Corrosive fetid ichorous discharges from the mucous membranes, vitality is greatly depressed. As I told you in the beginning, the product, the creosote remedy as such is a distillation of wood tar. That is why it is going to have something that is, like an end product. It is going to be indicated in cases which are also on the verge of, collapse or, dying. That's where you should also think of creosote. Severe headache before and during menses, like the remedy sepia. Roaring and humming in the ears with deafness before and during menses. So you have complaints before and during menses of the head, of the ear in this remedy. Very easy to prescribe if you have patients which point to these physical particulars, because physical particulars are going to be your prescriptive pointers rather than the mental symptoms which is bound to be dependent on interpretation. Painful dentition in children, teeth begin to decay as soon as they appear. So you will have a case of a small child who has just started to develop having teeth, but as soon as the teeth has come, it has started to decay, it has started to show signs of uh, decay, or the gums or the roots of the teeth are just appearing and there is blackishness or brownishness. That should point towards creosote. The gums are bluish, red, soft, spongy, bleeding, inflamed, scorbutic, ulcerated. Creosote, one of the other remedies where you can prescribe, one of the other conditions you can prescribe is in pregnancy. There will be sweet water, lot of sweet eructations would be coming with lot of saliva. Stylism is mentioned. And also in cases of cholera in the dentition, where there is lot of saliva oozing from the mouth, we think of Merc. We never give a thought to creosote. It should be given a thought if there is lot of saliva, lot of vomiting, and there is stool which is foul smelling. So all the excretory discharges will be foul smelling in nature. The blood will be foul smelling, offensive, dark colored, but there will be excess of salivation, just the case with ipecac, just like the case with Merc. In all the affections of stomach, where there is stomach pathology, it can be cancer, it can be gastric distress due to gastric ulcer, gastroesophageal reflux disease due to gastritis. If there is lot of salivation and there is lot of vomiting, sweetish eructations which come, creosote can be given a thought. Next you have for creosote, one of the top remedies that we often forget to give in cases of involuntary urination. There is a rubric in Kent repertory which says that involuntary urination, it is difficult to waken the child, and you have the same situation in Allen's keynotes. Actually the repertory is sourced from keynotes itself, different keynotes. So you have in Allen's keynotes for creosote, incontinence of urine, can urinate only when lying, copious pale urging, cannot get out of bed quick enough. This is same the case with apis and petroselenium. And if the urine happens during first sleep, so how will you recognize if it is first sleep? When the patient is asleep and in early part of the sleep, as soon as they go to sleep, in the first 1 or 2 hours, the urination happens. Sapia is one of the other remedies which should be thought of, from which the child is roused with difficulty. This is mentioned in Allen's keynotes. So you know now where to prescribe creosote. It will be in situations where involuntary urination is there, foul smell from the mouth or lot of saliva from the mouth, and urination happens only especially in the first sleep, which is first 3 hours or first 2 hours of patient or the child going to sleep. Smarting and burning during and after maturation, sulfur is the other remedy. Creosote can also be thought. In women who have complaints after the menopause has gone, you can think of creosote. Lachesis is one of the other remedies mentioned. Menses in case of creosote female will be early, profuse, protracted, pain which is there during the menses, but aggravated after it. So all the complaints that start after the menses, you have to connect the few dots from the source of the remedy. The remedy is the distillation of wood tar. The wood tar is the actual source, and from where this distillation has happened, which is the byproduct. Every complaint of creosote will mostly be after the discharges happen, after the complaints or majority of complaints have excreted itself out, like the blood, the discharges, the urination, and so on. So once you connect those dots, it will be easier for you to prescribe in your practice. Menses flow only on lying down, they cease on sitting or walking about. Cold drinks also relieve the menstrual pains. Flow is at times intermittent and it almost ceases and then commences again. Very difficult to find out from different cases. We tend to prescribe deeper polycrests, but This remedy can be given as an intercurrent remedy in such situations. Sulfur is the other remedy mentioned. How will you find out that this remedy is to be given in such female cases? You will have headache or ear complaints before or during menses. You will have urination complaints before or after menstruation, and complaints of female, the cramps, the pains, the weakness will be enormous, out of proportion after the menses, which is more difficult. Leukorrhea is acrid, corrosive, offensive, worse between periods. Bovista and borax are the other remedies. It also has the odor of green corn and stiffens like starch, stains the linen yellow. So all the remedies where you have the discharges staining the clothes, staining the parts surrounding in yellow or green should be thought of as psychotic or psychosyphilitic remedies or even syphilitic remedies. Next we have is lochia, which is dark brown, lumpy, offensive, acrid, almost ceases and then freshens up again. Quinine and sulfur are the other two remedies. Violent corrosive itching of pudenda and vulva. This is one of the most underrated remedies. Creosote is one of the most underrated remedies for itching of the female genitalia. We should think of this remedy, and in males you should think of the remedy caladium. If there is pure itching, no eruptions, just itching is there and very less eruptions are there. Itching is so violent towards evening as to drive someone almost wild. Again, you have the other remedy, itching without eruption, dolichos. I have given it frequently. Dolichos, phagopyrum and creosote can be indicated in such situations. Modalities of creosote, we come to the end. In open air, cold weather, when growing cold, when washing or bathing with cold water, rest especially when lying down is aggravation for creosote. Amelioration is better generally from warmth. So creosote as a remedy will not cure many patients, it will just palliate, and sometimes you will need this palliation because what follows next after creosote is arsenic, phosphorus and sulfur, especially in cases where there is deeper malignancy or cancerous tendency. Carboveg and creosote are inimical in nature because they are very much similar in their action, and we should think twice when we need to prescribe one remedy after the other. If you ever need to prescribe, you should give an intercurrent like sulfur or a deeper polycrest and then prescribe the other medicine. So that's all from today's session on Allen's keynotes, and we'll catch up tomorrow evening again around 5:15 with the other remedy which is similar to creosote. Stay tuned to know what the other remedy similar to creosote can be.